Welcome back to Learning Corner, your go-to platform for essential insights on a broad range of topics. We cover everything from health and fitness, to finances, to personal development. We believe in the power of knowledge and its potential to positively impact our lives. If you haven't already, please take a moment to subscribe, comment, and share our content. Remember, knowledge is power, and it's meant to be shared. Today we're stepping into the realm of mental health, a subject that's often misunderstood and stigmatized. We're going to unravel the mystery surrounding a condition affecting millions worldwide: anxiety attacks. We're not just scratching the surface, we're delving deep into what causes them, how to identify their signs and symptoms, and most importantly, how to manage them effectively. So, sit back, take a deep breath, and let's get started on today's topic. Anxiety attacks unveiled: causes, symptoms, and management. Ever been caught in the unsettling grasp of an anxiety attack, or as it is scientifically called, a panic disorder? This unexpected surge of intense fear and anxiety that makes your heart race, obstructs your breathing, and presents a looming sense of dread is what an anxiety attack feels like. But it's not just you. This is a collective experience faced by many worldwide. It's not a result of personal weakness or incapacity, but a legitimate mental condition triggered by certain situations or elements. Although a formidable encounter, remember, you're not the only one. Several individuals globally undergo this same ordeal. By recognizing the root of these anxiety attacks, we can work towards handling them more effectively, and this is exactly what this video aims to elucidate. What are the possible causes of anxiety attacks? Let's delve into the various factors that can contribute. Stress is a major player. It's something we all grapple with, whether due to job pressures, interpersonal issues, or financial strains. Extremely high levels of stress can push your body into the fight or flight state, pumping out adrenaline and other stress hormones. This can lead to physical symptoms such as a fast heartbeat, perspiration, and tremors, which often resemble an anxiety attack. Next, we examine medical conditions. Certain illnesses and disorders may imitate or trigger anxiety attacks. For instance, heart-related conditions such as coronary disease or arrhythmias could manifest symptoms similar to those of an anxiety attack. Also, hormonal imbalances brought on by thyroid issues or menopause may incite anxiety symptoms. Therefore, if you're suffering from recurring anxiety attacks, it's crucial to seek a comprehensive medical examination. The genetic factor comes into play. Much like physical characteristics such as hair color or height, anxiety disorders could be hereditary. If your immediate family members suffer from an anxiety disorder, it increases your chances of having one as well. Studies suggest that specific genes may make a person more prone to anxiety disorders, but it's a sophisticated interaction of genetics and environmental factors. Substance abuse is another trigger. Alcohol, caffeine, and certain drugs can lead to anxiety-related symptoms. In some instances, withdrawal from these substances can set off an anxiety attack, creating a vicious cycle that's tough to disrupt without professional intervention. Lastly, traumatic incidents can prompt anxiety attacks. Post-traumatic stress disorder, or PTSD, epitomizes this. Individuals who have faced traumatic events like auto accidents or warfare may develop PTSD, which frequently induces severe anxiety attacks, often instigated by reminders of the traumatic incident. As can be seen, numerous factors can lead to an anxiety attack. But how do you ascertain if you're having one? Identifying the signals of an anxiety attack is a pivotal move towards controlling now. We're going to dive into the various symptoms of anxiety attacks or panic attacks to aid in their recognition. It's crucial to keep in mind that these symptoms can differ greatly from one individual to another. Each person's encounter with anxiety attacks is as singular they are. A commonly observed symptom is a quickened heartbeat, where your heart seems to be thumping or racing. This can be quite unnerving and often amplifies fear. Another common symptom is experiencing difficulty breathing or feeling like you're being suffocated. This can induce a particularly distressing feeling of loss of control, or even a fear of dying. An impending sense of doom is another prevalent sign. This is an intense fear that something dreadful is imminent. It can be hard to articulate, but if you've felt it, you know it's as palpable as any physical discomfort. Certain individuals may also exhibit symptoms such as sweating, trembling, or shaking, while others may feel a sense of unreality or disconnection from themselves or their surroundings. Other physical symptoms can include chest pain or discomfort, nausea, or abdominal distress. These symptoms can be so severe that they are often mistaken for signs of a heart attack or other major physical diseases. Additional symptoms can involve feeling dizzy, unstable, lightheaded, or faint. fear of losing control or going insane, numbness or tingling sensations, chills or hot flushes. It's also crucial to remember that anxiety attacks can be abrupt and unpredictable, or they can escalate gradually and persist for several minutes or more. Comprehension of these symptoms can assist you in recognizing when you or someone else is undergoing an anxiety attack and could be the first step to discovering effective strategies to control it. With an understanding of what an anxiety attack entails, we can now turn our focus to ways to manage these distressing incidents. Handling anxiety episodes might seem like a daunting task, but possessing the appropriate tools and strategies can make it considerably less so. Recognizing what's happening is one of the initial steps in handling anxiety, also referred to as panic attacks. Realizing that your body is reacting to an envisioned danger even when there's no actual threat can assist you in feeling more in command. Let's delve into some efficacious strategies for dealing with these incidents. Deep breathing is a potent method. When a panic episode strikes, your breathing might become rapid and shallow, which can heighten feelings of fright and anxiety. By deliberately slowing your breathing rhythm and taking full, deep breaths, you can guide your body towards tranquility. Imagine air filling your lungs, hold it momentarily, and then exhale gradually. Repeat this process until you feel more composed. Grounding techniques serve as another effective strategy. These procedures help you remain grounded in the present, which can often appear elusive during a panic episode. Try to focus on the physical reality around you. Touch the texture of a nearby object or describe your visual surroundings. Concentrating on these concrete elements can help anchor your mind in the present, steering it away from spiraling thoughts. Cognitive behavioral therapy, commonly known as CBT, is a therapeutic approach found to be particularly productive for handling panic episodes. CBT involves collaborating with a therapist to identify and challenge the thought patterns that lead to anxiety. This therapy style can equip you with practical techniques to manage and decrease anxiety episodes. Lifestyle alterations can also leave a significant impact. Regular exercise, a nutritious diet, ample sleep, and minimizing caffeine and alcohol can all contribute to reducing your overall anxiety levels. It's crucial to remember that while these self-help strategies can be highly productive, professional assistance is often beneficial. Mental health experts, such as psychologists and psychiatrists, possess the training and expertise to guide you through this journey. They can offer personalized strategies and treatments, including medication if required, to help handle panic episodes. If your anxiety episodes are disrupting your daily routine, it's essential to consult a healthcare professional. Seeking help is in no way a sign of weakness. Rather, it's a symbol of strength and self-care. Mental health is just as important as physical health and deserves equal attention and care. There are numerous resources at your disposal, both digitally and physically, to assist you. From self-help literature and digital courses to support groups and therapy, remember you're not alone in this. Recall, it's completely normal to need assistance in handling anxiety episodes, and there are numerous resources available for help. Remember, you're stronger than you perceive, and with the appropriate tools and support, you can effectively handle anxiety episodes. In conclusion, we have explored the realm of psychology, focusing on anxiety attacks which manifest as sudden and intense fear episodes. Remember, these attacks, although alarming, are not physically harmful. They can be sparked by several factors, including high stress levels, trauma, or certain medical conditions. The symptoms vary but are merely temporary. We also discussed various strategies to manage these attacks, emphasizing that the goal is not to eliminate anxiety but to learn how to handle it. It's akin to navigating through a storm rather than attempting to halt it. Anxiety attacks are quite common. 1 in 4 people will experience them in their lifetime. But it's important to know that help is readily available. Understanding is the key to overcoming, so if you or someone you know is grappling with anxiety, do not hesitate to seek help. Until our next discussion, stay informed and stay healthy.